Good morning. I'm Dr. Pilest, and this is JC. She's one of our patients here today. She's here to improve acne on her face. We examined her skin and we saw very oily skin. She has some blackheads. She has some inflammatory lesions or papular lesions on her face. We discussed alternatives of treatment. We discussed the use of antibiotics. We discussed the use of lights, and we finally came to a conclusion that for her, since she has mild to moderate acne and some inflammatory acne, that the Isolaz would be a very good option for her. Isolaz is a machine that uses vacuum and light, and in this way one can destruct the bacteria that's causing acne, and meanwhile try to dry her skin up and help her with her blackheads. JC is okay with these treatments. We'll be doing a series of treatment on a weekly basis. Each treatment lasts about half hour. There is no pain with this treatment, and there is no aftercare. So essentially she could put her makeup back on and continue with her activities. So this is our Isolaz machine. This machine, as we just discussed, uses vacuum and light. And basically we use the power that we want to use. And since she's level 3 to 4 skin, we decided to use a fluence of 3, which is well tolerated by patients. We can use 2 different options on this machine depending on the type of their skin. Here we have the tips. There is 2 kind of tips. We have a large tip, which we use all over the skin of the cheeks. It can also be used on back, chest, and arms acne. And then we also have a small tip which we can use on difficult areas to treat, such as upper lips and the nose. These tips here are for profusion. With this machine we can also profuse products. In other words, we can put products on the skin and then drive them into the skin without any pain. In this way the skin will get better faster. And we primarily use salicylic acid to dry the skin and improve the blackheads. So we already have our parameters set at 3 joules, and this is the large tip, and we're going to treat her cheeks first. So as you can see, this tip will grab the skin, and then it will deliver the broadband light. So you can see the vacuuming of the skin into this tip. So essentially the skin is very, very close to the machine that's going to be delivering the broadband light. And if there are any blackheads, it will open the blackheads and the sebum will be extracted out. Otherwise, it will be just delivering the broadband light. So we generally do multiple passes depending on the severity of the acne. Now this is the second pass. Are you comfortable, JC? Mm-hmm. Yeah, there is some little feeling of warmth maybe or heat, but there is really essentially no pain with this. And as the patient comes every week, we will increase the power to get to destruct more of her acne. So we've completed the Isolaz treatment using the Isolaz tip. What we'd like now to do is to do the profusion, and we use this profusion tip, and we put this sponge, and then we have some salicylic acid here that we'll put on her skin. And we'll profuse with this special tip. So we're trying to derive this salicylic acid straight into the pores and under her skin, so that her acne lesions will get better faster and the recurrence of her lesions will be less. And this is called the profusion. So what we've done is we have vacuumed her skin, we've cleansed her pores, we have destructed the bacteria, and now we're putting some salicylic acid directly under her skin. So we essentially finished with the Isolaz and the Profusion, and at this time, as you could see, there is some redness that will probably disappear in about half hour to 1 hour. At the end of the session, as far as aftercare, there really isn't a whole lot of aftercare. Patient can resume activities. They can resume applying any of the topical care. Here in this office, we use benzoyl peroxide right after, or we can use salicylic acid or glycolic acid or whatever the patient is used to, and put some sunblock on, and the patient is ready to go back to her activities. So therefore, we'll see her back in about a week. The only thing that we tell them is sometimes when we clean the pores and bring all the blackheads up to the surface, occasionally there is some worsening of the acne after the first treatment, but that should probably be helped on the second and third treatments, so where there is no activation of the acne.